We are deep into one of the worst flu seasons in a while. Cases and hospitalizations with the flu, those are through the roof.
Yeah, so Upstate Global Health Director Dr. Stephen Thomas joins us now for a clearer picture of what's happening locally.
Yeah, let's actually get to that. What do the numbers, the actual numbers, look like here in central New York?
Yeah, so we still have a significant number of people that are hospitalized. That's both adults and children.
Okay,
unfortunately.
Equally?
Well, they're not equal, but if you compare them to where we were last year, the numbers are significantly higher. The good news, though, is that we may have hit a peak statewide, and we may have hit a peak locally. So where we were compared to last week is on the decline. So the number of people who are testing positive for the flu is down. The number of people who are in the hospital is also down. So potentially good news. The caveat on all that, what just happened this week, all the kids all went back to school. And so the highest rates of influenza we've had in the state are in kids under 10 years of age. The highest rates of hospitalization we've had in the state are people over 65. So kids can drive transmission of influenza. So I'm going to have very measured optimism that we've actually reached our peak until about another 10 to 14 days.
Right, because you know those classrooms are like petri dishes, right? But
yeah.
So let's talk about the cases that we have seen. Hospitalizations up. So what's the severity of the flu?
Yeah, so and again, some potential good news there is, you know, when you look at severity, is it a numbers thing or is it the actual virus itself? And so right now, people do not believe that it is the virus itself that is driving all of these hospitalizations. What we think is that it's lower number of people getting vaccinated and just the high numbers of people getting infected, that the pool is so big that the hospitalizations are also going to appear higher. But we don't think that it's because this virus is causing more severe disease in people. So that's another piece of potentially good news.
But is the vaccine matching up with it well, or is it not a good match? I mean, it's kind of a little bit of a guessing game.
It's not it's not a good match. You know, so we months before we started to see this, what is called subclade K. So it's sort of like if you think about COVID, it's one of the variants of the SARS-CoV-2 virus. So we knew that when we first started to detect that this was circulating, which was in the summer. We started to see it in New York and in other places in the country. We knew that it was not a good match for the strains that they picked for the vaccine. So that's the bad news. The good news is some of the early data that has come out, because this started circulating in places like Japan and Hong Kong and the UK months before it started circulating here. Data coming out of the UK shows that in children, getting vaccinated can reduce their risk of hospitalization by 75%. And in adults who are getting vaccinated, it can reduce your risk of getting hospitalized by a third. So that is still a significant clinical benefit that people can have from getting vaccinated.
Right, not too late, right?
Absolutely not. Absolutely not. We see influenza in central New York sometimes into June. So if people haven't gotten vaccinated, especially if they are at high risk, so the very young and the very old and people that have underlying medical problems, I would absolutely strongly consider getting vaccinated and going and get vaccinated.
Right, especially in light of what you just said as far as the circulation of the flu. You mentioned COVID, and many of us are curious because we haven't really heard much about COVID. What is the status?
So again, some potential good news. It's out there. We still see patients with who are testing positive. And we still see people who are being admitted to the hospital, but the numbers are just kind of hanging out at a very low level. This past week, we started to see a little bit of an uptick locally. They've started to see increased activity in wastewater, so they can measure the virus in wastewater. So we are watching it very, very closely, but flu is still the main story right now.
Another big story, though, that's come up yesterday, the CDC announcing that it's cutting back the number of vaccines it will recommend for children, changing that schedule. What are your thoughts as an infectious diseases doctor? What are your thoughts on that? And what will not be recommended anymore? I've heard flu, COVID, RSV, right? Not recommended?
Yeah, so, you know, I wish I could say I was surprised, but I'm not surprised. I think it has always been the intent of the secretary and the people that he has handpicked to guide him in these things, that they were going to do this. And so they went from universally recommending 17 vaccinations down to 11. They put kids into 3 different groups. the group of everyone should get these, the group that you should get these if you're at high risk, and the group that, well, you should talk to your clinician whether or not you should get this, which, by the way, people have always done, right?
Sure.
And so vaccines like hepatitis A, hepatitis B, COVID, flu, rotavirus, things that before we had vaccines or before they were universally recommended, put thousands and thousands of children in the hospital every year. They are now saying we don't universally recommend them. We think you need to have a conversation. And so what is ultimately going to happen is less children are going to get vaccinated, more children are going to get sick, more children are going to end up in the hospital, and more children are going to end up dying. And there is no, at least to my knowledge, I do not understand the scientific rigor that they used to make this recommendation, because those recommendations were on the books because of decades of science and decades of medicine and decades of people assessing and reassessing whether it was required. So it's a little bit of a disaster.
I'm going to make you try to do this quick because we're basically out of time. But what would you say to a parent out there that now hears this? I shouldn't do it. They can still do it, right? What would your recommendation be?
Yes. So what Dr. Oz, head of CMS, has said is that insurance will still cover all these vaccines, and that people should still have access. What I would say to them is that continue to trust your Onondaga Department of Health, or whatever county you are in New York. I believe you can trust your Department of Health. You can trust the state Department of Health. You can trust your local experts and your clinicians. And you can trust groups like the American Academy of Pediatrics and what they are recommending. I know personally, I no longer find the CDC a credible source of information when it comes to vaccines and vaccination. And that's a horrible thing to say, because there are still hundreds and hundreds of professionals who know what they're doing, but they're not the ones with the microphone right now.
It's a strong statement.
It is.
Dr. Thomas, we always appreciate your insight. We'll see you back here real soon. Thanks.
Thank you.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.